Good day, everyone. I am Maria-Paula, a student nurse from ISU Echage. And for today, I will be performing return demonstration and the assessment of the skin, the hair, and the nails. So, prior to performing this procedure, we have to, of course, perform the proper hand hygiene and done our PPE if necessary. And then after that, we can now proceed to the assessment. So, ma'am, I am Maria Paula D. Valenzuela, and I will be your student nurse for the day. In order to provide privacy, if there are any curtains or doors in the room, we have to close them as well. So, after that, we have to explain the procedure to our patients. Okay, um, so what do you want to call you, mom? Natalie. So, Natalie, so I'm here to perform an assessment of your, um, on your skin, your hair, and your nails. And why do we do this? To ensure that everything is normal, and if there are any abnormalities in your skin, like discoloration or skeletons, we are going to note them in order to prevent any further complications. And then, so after that, we want to remove the clothes of our patients and put on the examination in down on them. So, can you in order to cover the exposed parts of our clients, we have to remember to expose only the parts that we are going to examine, and cover the rest of the parts that are not going to examine. So first, note for any distinctive odor emanating from the skin, and then we will now inspect for generalized color variation if brownness, yellow, pinkish, cyanosis, um, jaundice, erythema, and vitiligo. So, but as I can see, uh, it's color yellow to brown, so it is normal. So next, check for skin integrity, noting for skin breakdown by paying attention to the pressure areas. Ma'am, can you turn so that I can check your back if there's any pressure? So we will now inspect the primary, secondary, or vascular lesions. Note the size, the shape, the location, distribution, and configuration. So it is normal. There's no any lesion on her skin. So we will now palpate the lesions. Glove hand palpate skin lesions between the thumb and the index finger for the size or mobility, consistency, and the tenderness. So we'll now palpate the texture, if rough or smooth of her skin. So we will now use the palmar surface of the three middle fingers. So it is smooth. Then we will now palpate the temperature, if cool or warm or hot. So it looks like that my patient has normal temperature, and for the moisture, it is oily and it is normal. So we will now palpate the thickness of her skin with our finger pads. So, we will now proceed to palpate the mobility and trigger by pinching up uh, skin over the sternum. Using our Teo finger, gently uh, pinch the skin over her clavicle. So we will now palpate for the edema by pressing the thumb over the pit of the ankle. So we'll now press firmly with your thumb for at least 2 to seconds on each extremity. So over the dorsum of the foot, and then behind the medial malleolus. So we will now proceed to inspect the evenness of growth of the skull. So evenly distributed hair, so it is normal. So we will now proceed to inspect her hair thickness or thinness. So it is thick hair, so it is normal. So we will now inspect her hair texture and oiliness. So it is silky and it is normal. So we will proceed to inspect the amount of the body hair. So it is variable and it is normal. So we will now proceed to inspect the nail. Inspect fingernail plate shape to determine it is a curvature. And so the convex curvature angle of her nail plate is 160 degree, so it is normal. And then inspect the fingernail and the toenail, and it is smooth texture and it is normal. And now we will now proceed to inspect her fingernail. Fingernail. The test for uh, capillary refill. We will press the nail tip briefly and watch for the color change. And it is color pink, and so it is normal.